reform the legal framework governing the pharmacy profession here in Dominica. It possesses the establishment Pharmacy Council to regulate pharmacists and pharmacies and the distribution of medication to the public. The bill represents a significant upgrade to the pharmaceutical services in our country, aligning with our ongoing efforts to modernize healthcare and healthcare services. Honorable members of this House, let us consider the pivotal role that pharmacies play, as our elders fondly remember them as being dispensaries in the past. They often serve as the first point of contact for individuals seeking medical advice and act as essential liaisons between healthcare providers and patients. First and foremost, Mr. Speaker, this bill is crucial to ensuring patient safety by establishing and enforcing rigorous standards for dispensing medications. We can guarantee proper handling and storage, thereby minimizing medication errors and safeguarding patient health generally. It is essential not only that our pharmacies operate in safe environments, but also that they undergo regular inspections to maintain these safety standards. The bill also emphasizes accountability and responsibility within the pharmacy profession by clearly outlining the ethical conduct and duties of pharmacists. We uphold the integrity that is vital to public trust in our healthcare system. Furthermore, we must recognize that pharmacists are not merely dispensers as they were in the past. They are trusted healthcare providers. This legislation empowers pharmacists by equipping them with the resources and recognition that is absolutely necessary to deliver critical services such as vaccinations, chronic disease management, and healthcare screening. The establishment of a pharmacy council will delineate the requirements for registration and ongoing professional development for pharmacists. In addition, Mr. Speaker, this bill seeks to enhance transparency and accountability within the pharmaceutical supply chain. By regulating this essential sector, we can ensure that medications are safe, they are effective, and they are free from counterfeit risks. Public health initiatives also stand to benefit immensely for this legislation. Pharmacies are pivotal participants in campaigns from immunization drives to education initiatives and disease prevention. Moreover, we must encourage innovation within our pharmacy sector. This bill lays out a framework for adopting technological advancements such as e-prescriptions and digital health platforms, making our healthcare system more efficient and patient-centered. I would also like to highlight that this legislation aims to improve access to medications, particularly in underserved populations. Of health strives to make various improvements and provide equitable healthcare services. This bill will most certainly facilitate the availability and distribution of essential medications where they are most needed. Lastly, we acknowledge the various workforce challenges that exist throughout pharmacies, not just here, but in the region and internationally. For us, this bill provides a roadmap for workforce planning. It promotes local training programs, professional development, and it clarifies the role of pharmacists. The passage of this pharmacy bill is not merely an administrative task. It represents an investment in our collective health system and services. It recognizes that pharmacies are vital components in our health system, and it's integral to supporting our citizens. Mr. Speaker, with these few words, I now commend the bill to the House for debate.
The bill is before the House for debate. Yes, Senator Edwards, you may proceed.
Mr. Speaker, I rise to give my support to this bill before this House. Mr. Speaker, this bill has been in the process for a very, very long time, and it was done deliberately because in health and in the healthcare of people, you don't do things in a rush. So the Ministry of Health deliberately, we did consultations, we inquired, we deleted, we added, and then we came here with the final product. And we are very confident that this pharmacy bill is going to take pharmacy to a different level, Mr. Speaker, because this bill is replacing a bill that was done in the 1930s called the Druggist and Chemist Bill. As you heard, pharmacy was not even in the vocabulary then. That was in about 1934, 2 years after Alexander Fleming accidentally discovered penicillin. So there was only one antibiotic in existence when this bill, the old bill, was enacted. It goes to show that it was due for a better bill to govern pharmacy, Mr. Speaker. Mr. Speaker, the Ministry of Health is fortunate to have had a very good working relationship with the Dominica Pharmacy Association. They were consulted, and the PS then, Mrs. Lestrade White, is a healthcare provider, and the PS now, fortunately, is a medical doctor. So we must congratulate Dr. Esprit and her staff for what they did for this bill, Mr. Speaker. From the Ministry of Health consulted extensively across the board with all healthcare providers to take their advice and to listen to what they have to say in conjunction with the AG chambers in order to get this bill formulated and taken to the Parliament. So, Mr. Speaker, the pharmacist, as we know, is the central between the physician and the public. The pharmacist is who is responsible for the procurement, the storage, distribution, and dispensing of drugs and pharmaceuticals in the medical fraternity, Mr. Speaker. And it is only fair that with the evolution and the changes that have taken place over the years, that a bill is enacted, a law is enacted to govern, to regulate, and to make sure that what is being done as pharmacists is helpful to the public. Because Mr. Speaker will agree with me that any profession that deals with the well-being and the welfare and the health of the public needs regulating, Mr. Speaker. Mr. Speaker, with the Dominica, with pharmacists worldwide, as you know, pharmacy is not only a public sector area, because there are also private pharmacies as well. And with the advent of new drugs and new diseases, other medical professionals also have their enactments, and they also have the regulations and the boards to govern them. So pharmacists is very, very fortunate now in Dominica to have this bill before this House. Mr. Speaker, it was done with, like I said earlier on, with immaculate consultation among everyone involved in the Ministry of Health and otherwise. Mr. Speaker, with new diseases, new trends, new chemicals, any body that is in possession of any substance that could affect people's well-being must be regulated. And the Ministry of Health, Mr. Speaker, in moving forward, will be visiting this legislation and making sure that everything is in place and putting things in place and enacting new small parts of it because there is never a perfect law, Mr. Speaker. So as time passes, we will be visiting it again, Mr. Speaker. Mr. Speaker, in this legislation, you will see that a pharmacy council will be governing the profession. In the past, it was only done by the medical board. When one man or woman qualifies to be a pharmacist, he or she would be registered by the medical board and go to receive a license to practice. But with this legislation, Mr. Speaker, it is going to be more in-depth, it is going to be more concise, and everything will be in place for a better health care for the people, Mr. Speaker. Mr. Speaker, the Ministry of Health of Dominica has been doing what is supposed to be done for the betterment of the health of the people. We know that NCDs and other diseases are prevalent amongst our people, Mr. Speaker. And the pharmacists will be playing a pivotal role in the fighting against these diseases. Mr. Speaker, I have been listening, Mr. Speaker, to some of the criticisms, if I should use that word, of the Ministry of Health. But Mr. Speaker, I am not the one to say it is unfair, but I can only say what I know the Ministry of Health is doing for the people of Dominica, Mr. Speaker. This is the Ministry of Health, Mr. Speaker. This government inherited a health system that was, and a hospital, Mr. Speaker, that was built in the 50s and was operating like the 50s, Mr. Speaker. Mr. Speaker, there was no ICU at the hospital, Mr. Speaker. There was no imaging, well, the imaging equipment at the hospital was very bad, Mr. Speaker. There was no dialysis machine, Mr. Speaker. And Mr. Speaker, this hospital has been developed into what it is today, into a modern first world hospital, Mr. Speaker. And we are seeing a big revolution in healthcare in Dominica. And this government has put healthcare front and center because we know that healthcare, with good health, you get good wealth, Mr. Speaker. Mr. Speaker, this government, upon entering office in 2000, immediately realized that we sent people to study. The government sent people to study overseas because there was a need for pharmacists, lab technicians, nurses, doctors. Every healthcare profession was trained by this government, Mr. Speaker. And after that was done, the government of Dominica enacted upon developing the healthcare infrastructure. And if you look around, Mr. Speaker, because we need to repeat those things. When you repeat those things, people will remember, because people tend to forget sometimes. Just a small refresher. You see a new health center in Marigot, a new health center in Wesley, a new health center in Vehicles, one in Ansdime, Georgetown, Collyho. 13 new health centers were built to augment the primary healthcare system, Mr. Speaker. Plus hospital, Mr. Speaker. And Mr. Speaker, now that is completed, we are coming now to regulate the professionals that are going to be put in place to man these buildings and these professions, Mr. Speaker. So, Mr. Speaker, I am there today to support this bill, and I'm sure that this bill is going to help in the development of pharmacy in Dominica, because pharmacy is an integral part of the healthcare system in Dominica, private and public sector. There are several medications that are being used today that needs regulating. I won't go into that now. And this bill will help in enacting this, Mr. Speaker. So with these few words, I support this bill 100%.
Yes, Dr. Vincent, that's an honorable. Proceed.
Thank you very much, Mr. Speaker. And I am encouraged to speak after dispenser, who's now become a pharmacist. But listening to Senator Edward, I must say, very impressive. Very, very impressive. And as a practitioner, I feel comforted by his words. But Mr. Speaker, I stand to give my support to this legislation for a number of reasons, but I will only speak to just a couple of them. Health is of critical importance to all of us. All of us. All of us will get ill at some point. All of us will have reasons to go to a pharmacy, to go to a health center, a hospital, whether we want to or not. And it is important for the state, because the state has a monopoly on this. It's only the state can regulate those activities, and therefore the state must take that responsibility very seriously. And that's why I want to commend the Minister of Health and the ministry for bringing this bill to the House today, because I think this is a very, very important step. But one of the things that I saw in there, 2 points actually that caught my attention, that really moved me to speak, is the fact that we are regulating a profession, and for the first time I am seeing in the regulation of a profession, we are actually defining what the requirements are, but we are also moving on to section 5.1, where the council shall determine continued professional development. And that I find that is what that really moved me. So 5.1G really, it reads, the council shall make recommendations for regulating prescribed requirements for continuing professional development of pharmacists. Because I have a difficulty with people becoming professionals and they get registered and they have a license to practice for life. I mean, look, you heard what the pharmacist said. Senator Edwards said, when the pharmacist bill, when the bill was first passed, the act that governed, the pharmacists, we only had one antibiotic, is penicillin we had at the time. So how is it that someone who graduated from a program that qualified them to become a pharmacist would know what is the real thing today? How do you know that? By watching the news? By reading a paper? It is important that professionals must be subjected to continued professional development. And I'm hoping that, Minister, we can move quickly to do the same for the medical doctors. The Medical Professions Act should also demand continued professional development. That is how it's done in the rest of the world. I just completed my 12 hours of continued professional development in order to maintain my license in the Law Society of Ontario. You have to do that every year. So you have to go to a seminar, listen, and you have to do all the things that are required to ensure that you know what the law in this case is developing too. So to maintain my license as a lawyer in Ontario, I must do that every year and pay a fee for it. ACLS, BLS, all of those things that doctors do, that should be a requirement every year. It should not be optional. They need to know what is happening in the profession. They cannot just sit there and assume that because they went to medical school and they learn stuff. Research is being done all the time. New medications are coming on all the time. The effectiveness of medications and all of these things continue all the time. So you have to ensure that professionals are subjected to continued professional development. And that is one of the most progressive things I have seen in this bill. There are lots of progressive things. For the first time, we're establishing a council, a pharmacy council for pharmacists to govern the work that they do. And that we are also, in a very practical way, Section 8, subsection 1, the Education and Training Committee shall examine applications for registration and advise the council on the adequacy of the qualification of an applicant for registration, and in a relevant case, the additional qualifications that are required for registration. I read this because, I highlight this because I believe we need to do the same for the nursing profession. I believe we need to de-entangle ourselves with some of the regional requirements if the region is not prepared to review their requirements. Because there is no reason why a young Dominican should go to nursing school, be it at the State College or at All Saints, get a nursing degree, and still have to be subjected to a regional examination. I think we need to be able to align the requirements throughout the region with all the educational institutions and to ensure that nurses have the relevant prerequisite to be registered to practice nursing. Some of the requirements, they make no sense. Some of them were imposed by people who wanted to create gatekeepers, so that less people would qualify into the profession. These things are adding no value. It's like having math as a requirement to be a good nurse. I mean, how much medication you have to count? What formula you need to learn to count how many patients you have? No, but seriously, we need to review those things. If we are going to be a progressive society, we need to continue to revisit things that we met there. We can't just meet a thing there and try to come. You know what bothers me? People sit at a time, they start at a time, they came up with requirements. And for whatever reason, personal, professional, whatever reasons, they put their requirements. Some of the things have nothing to do with effectiveness of the profession. And we today try to justify what people created decades ago when we have no background on that, and there is no justification, no rationale for these things, and we're afraid to challenge them. When I was Minister of Education, I had a problem with CXC. I accused CXC of creating CAPE as if it was Superman, you know, when the fellow go in the booth and he come out as Superman. That is what they took GC and make with CAPE. CAPE did not truly reflect at the time what we needed in the Caribbean. Fortunately, we have seen the transformation of CAPE. And now CAPE is embracing what we should be focusing on. We needed to ensure we have training where people can move. That there's currency in your qualification. Whatever diploma you have, you should be able to move throughout the world with it. If you create something to just remain in the Caribbean, what good is it to us? People want to move, and people will move. The same way, for pharmacists, for nurses, for doctors, we need to define what the requirements are. We have a big debate, and let's not kid ourselves about it. There are those who believe that people who train in Cuba may not have what is required to be consultants, to become specialists. Let's discuss it. As a serious, country, let us discuss those things and let us come to a determination. What are the requirements for those professions? And at every stage. And I'm looking forward to the minister bringing this. I'm not sure if I'll be here to debate it, but I am looking forward to the minister bringing this matter to the parliament, because I believe we need to make some clear determination on these things. So I am very encouraged by this first step, and I'm hoping that, Minister, you move with alacrity to bring the Medical Professions Act. Let us take a final determination on what we are requiring for people to practice medicine and to be categorized as specialists and all of those things that we need to do. And to ensure that in there we have the requirement for continued professional development. I don't think it is fair for someone who, and Dr. Williams and Dr. McIntyre, I am not in any way casting any aspersions on you, since I know that you practice, rather, maybe not frequently, but you would meet the requirements because you do an occasional practice. But you cannot have a license to practice medicine. You go to another profession, you do that for a while, and then all of a sudden you come and want to cure people bobo. I mean, that can't be right. That can't be right. I'm not sure when last you practiced. Even in the region, There are countries in the region that require that you must have had a recent number of years of practice for you to get a license to practice. If you were to move in another jurisdiction in the region, I know there are countries that require that. And these are things we need to do in a very progressive way, and to ensure that we can enhance the quality of service. We can ensure that the people who are licensed to practice do in fact have the competence to practice, because we're talking about people, about matters sometimes of life and death. So, Mr. Speaker, I thank once again the Minister for bringing this progressive bill to the Parliament, and I have no hesitation to give my full support to the new Pharmacy Act.
Thank you very much, Mr. Speaker, and also to Honorable Dr. Henderson for his contributions, and also to Senator the Honorable Kent Edwards. Of course, Alexander Fleming would be extremely proud of the contribution by Senator the Honorable Kent Edwards. And I will say that Fleming is often remembered as having possibly the single most effective or victorious invention on disease prevention. And I think in that same spirit, Senator Kent will go down as having one of the single most dynamic presentations on healthcare in the history of this parliament. So Fleming would certainly be proud. But to move away from the humor, I am extremely proud. And Dominica is indeed blessed to have someone like Honorable Edwards working as Parliamentary Secretary in the Ministry of Health. Because when we came in 2022, what we inherited was a health system that really was plagued by COVID-19. What you find that around the world, all health systems were under stress, severe stress. The focus would have been on keeping people alive all around the world. And in that spirit of keeping people alive, many areas, many aspects of health were taken for granted or overlooked. And in inheriting this system under duress, under strain, we had to effectively build back, to work with health professionals who were effectively tired, overstressed, a health system where even our supply chain would have been challenged because the focus would have been on vaccines and medications for people with upper respiratory challenges and so on. Mr. Speaker, we inherited a ministry. Because of COVID, we had stockouts of 46% in some regard. And due to the hard work, the diligence, focus, we were able to reduce that to 3%, Mr. Speaker. And oftentimes, as Senator Edwards would have said, that we usually placed under the microscope for some small things. I don't want to say innocuous things because everyone's situation is important. Every case matters. Every complaint matters, Mr. Speaker. But for the most part, without a doubt, the focus every day is on the health and well-being of the people of Dominica, to improve the governance structures in the ministry. And I'm happy that he was able to give us this walk through history, whence we came from and where we are today, Mr. Speaker, because we would have seen that there's a photo in social media right now of what the old Princess Margaret Hospital looked like. And I sometimes read comments just to understand where people's mind space is. Where are they? And I see comments, Mr. Speaker, and I sometimes ask myself, why aren't we more grateful as a people sometimes? Because we have come a long way. We have what in fact is a brand new hospital in Dominica China Friendship Hospital, where this government transformed a small space into what we have today. Where before, as Senator the Honorable Edwards said, we only had one imaging modality, X-ray only, and now we have 6 different imaging modalities, Mr. Speaker. This is where we have come. And we have operated in a strategic manner over the years, where we're focused not only on the infrastructure, but also the equipment to support the services. We're focused on training by way of one graduate, one university graduate in every home. And we have, or people have benefited tremendously from the training programs in Cuba and other places. And now we have many doctors, many specialists, Mr. Speaker, for the very first time in areas that we have not seen before, cardiologists, and we have vascular surgery and nephrology, so many areas, ophthalmology. Never before have we had our local doctors, our local specialists. And this is the type of vision, this is the approach, the holistic, comprehensive approach of this government, a government of focus, a government of planning, a government of implementation. So we have come to this point today that we have taken care of part of the issues, which would have been the infrastructure, with the equipment. And now we're focusing on other areas that require strengthening, which would be governance. Hence the reason why we're bringing this bill forward today, Mr. Speaker. So I'm happy that this has been received well by my colleagues. We will continue to strengthen, and I'm pleased that Honorable Dr. Henderson was able to raise and elevate the discussion today and ask about other professions also. And I'm pleased to let him know that, and he said that he hopes he will be there. And as long as he has life, in the first quarter of next year, we shall see the medical professional bill coming here, and nursing bill coming here, and also to framework for tobacco control coming here, Mr. Speaker. We'll see these things coming forward. And they're in final stages. Some have been completed as well. In terms of the medical professional bill, it's one simple nuance, Mr. Speaker, that we are trying to contend with right now as it relates to specialists. And in the spirit of engaging and consultation and so on, while we have this urgency to bring it here, Mr. Speaker, we don't want to come here. We could have come today, but we don't want, when January comes, the first quarter of next year, the first thing we do is to come back and to have an amendment, Mr. Speaker. So it's just one final tweak. And I'm grateful to all who have supported in the preparation of this pharmacy bill. I have already expressed my gratitude to Honorable Kent Edwards, but to express to the public also that when we wanted to get this back on top of our priority list, we held a meeting and he was tasked with the responsibility for leading the stakeholder consultation, and he has done an excellent job in doing so. So I must continue to express my gratitude. And to the various people who've supported him at the ministry, the permanent secretary, the chief medical officer, the chief pharmacist, even chief pharmacists of the past, people like Errol Thomas. We also wish to thank OECS Pool Procurement for giving us tremendous support throughout this process. Rosalind Opel and Abraham Weeks in particular, we're indeed grateful for them. And of course, AG's office played a tremendous role in this process. I wish to express profound thanks to Pearl Richard Xavier, Chief Parliamentary Counsel, for helping us in this process. So I'm grateful to all. Thank you. And Dominica stands to benefit tremendously by the enactment of this bill. Thank you.
This concludes the debate. It has been moved and seconded that the bill shortly entitled Pharmacy Act 2024 be read a second time. Those in favor? Aye. Those against? The ayes have it. The bill will now be read a second time.
Pharmacy Act 2024.
The bill will now stand committed to a committee of the whole House to be considered clause by clause. House is in committee. Report that the bill shortly entitled Pharmacy Act 2024 passed the committee stage without amendment. The question is that the report of the committee on the bill be adopted. Those in favor? Those against? The ayes have it.
Mr. Speaker, I move that the bill shortly entitled Pharmacy Act 2024 be read a third time and passed.
Second.
Seconded, Mr. Speaker.
It has been moved and seconded that the bill shortly entitled Pharmacy Act 2024 be read a third time and passed. Those in favor? Those against? The ayes have it.
Pharmacy Act 2024.
The bill has been read a third time and passed accordingly.
Mr. Speaker, I move the second reading of the bill shortly entitled Medical Laboratories Act 2024.
Seconded, Mr. Speaker.
Mr. Speaker, this medical laboratory bill applies to every laboratory, both public and private, in Dominica. I'm certain we can all appreciate the urgency in enacting this bill. In our modern world, laboratories serve as the backbone of medical diagnostics. They play a pivotal role in detecting disease, monitoring treatments, and guiding medical decisions. Yet without proper oversight, the very same systems designed to protect the public health can become a source of harm. A laboratory bill is not just a matter of regulation. It is a safeguard for quality, compliance, standardization, accuracy, and trust. Mr. Speaker, the proposed bill is divided into two parts and 19 clauses and speaks to the requirements for licensure and the requirements for operations. These comprehensive principles are essential for many reasons. The bill ensures greater accuracy and reliability. Licensed laboratories will be held to strict standards and operations, from equipment calibration to staff qualifications. These standards will ensure that every test result is accurate and reliable, reducing the risk of misdiagnosis that could jeopardize patients' lives. Essentially, the bill will help to build greater confidence and public trust. Unregulated or substandard laboratories can pose significant health risks, including the spread of infectious diseases due to improper handling of samples. Licensing establishes protocols that prioritize safety for both patients and healthcare workers. And this will help to build public trust when individuals know that their diagnostic tests come from licensed, compliant facilities. It strengthens trust in the healthcare system by doing just that. Mr. Speaker, a sound governance structure will put us in a position to address challenges faced in the sector by enhancing quality management systems, safety programs, and surveillance programs, which are all critical in our quest towards the accreditation of our national laboratory. From a public health perspective, it will allow data sharing for surveillance purposes across all laboratories, whether public or private. This legislation will propel laboratory support systems for procurement of supplies, equipment, and consumables, and therefore it is expected that the national laboratory will reduce the occurrence of stockouts or unavailability of equipment and supplies. Further, this system will ensure that laboratory operations across the island are environmentally friendly and cost-effective with enhanced data sharing capabilities and capacities and transfer protocols. Mr. Speaker, colleagues, you all know that as one of the ministers on the slightly younger side, Mr. Speaker, I believe in moving and growing with the times. With the implementation of the soon-to-be Health Management and Information System, HMIS, that is already being implemented, where digitalization of reports and sharing will occur on multiple platforms, this aspect of the legislative and regulatory framework will play a vital role in data protection particularly. The physical security of the laboratory is also an important aspect in protecting databases and hardware that stores important information. This legislation ensures that all laboratories maintain laboratory information management system properly and confidentially. Passing a laboratory bill is not merely creating a barrier or about mischievously micromanaging the work that is being done right now, but instead it's about establishing a foundation of excellence and fairness that all the people of Dominica will benefit from. Mr. Speaker, with these few words, again, I commend the bill to the floor for debate.
The bill is before the House for debate. Yes, Honorable Henderson.
Mr. Speaker, I rise in support of the Medical Laboratories Bill, primarily for the fact that I once used to operate a lab as a teacher of chemistry. I really love the lab, just like you. And, but more so, as minister responsible for the Bureau of Standards, we continue to highlight the need for standards. Standards in everything we do, testing, certification, accreditation, to ensure that consumers who require the services can be guaranteed that the state has, in fact, endorsed the use of a facility. We have seen in recent times the rise of private laboratories. I mean, we have several private labs throughout Dominica now, well, especially in Roseau. I'm not sure in Portsmouth. But yeah, some of them operate, yes, as well in Portsmouth. So we've seen Adams, we've seen Medicus, we've seen so many of them, which is great, which is a sign of, in my mind, progress. Because the private sector is now incentivized, and people only go in business because their primary objective is to make money. Some people have a passion for something that they would like to share with others as well, provide a service. But it means that there are reasons to go into this business, and they continue to operate. It means that they are being profitable. I would hate to feel that someone who is making a loss will continue to operate. So that says a lot about the state of the economy to some extent, but the fact that people are incentivized to pay for medical services. And later, I guess you're tired of hearing of me, but I want to speak on the other bill because I want to speak to that point, because people are incentivized to pay for medical services. And they do when they have to. And we have seen a shift where more people are seeking the use of private labs than they would the government labs. So, Mr. Speaker, the point that I wish to focus on is really about the appointment of inspectors. Well, first, the regulations that are required, the requirements to be certified, to be accredited, and I'm not sure which approach that the bill envisages, but I think it would be important to have the certification, the requirements for getting a license, but there should be a level of accreditation that could become more a regional or international level accreditation. And this is why the Bureau of Standards, we work with COSCU, which is a CARICOM regulatory organization body that provides certification and accreditation of labs, of standards that are required, especially in trade. But it is important for us to work towards international accreditation for our lab, because it would mean that a tourist who visits or visitor who comes to Dominica for business or pleasure would be able to utilize our labs, and their insurance companies would accept that as a valid facility. So we need to now connect and ensure that we can have that type of accreditation that would allow our laboratories to be able to benefit from any business that they could get. I know the cruise ships have the special requirements and arrangements for medical services, So we need to perhaps consult with them to find out. The insurance companies here should know a thing or two about the international accreditation, because I know even the hospital, we're working towards accreditation for that very same reason. And as we continue to develop a more thriving tourism sector, we have to ensure that we contemplate those factors that will be important to make this a very attractive, make Dominica a very attractive destination. So we need to take that into consideration. In addition, the bill makes requirements for the appointment of members on the council to have the director of the Bureau of Standards on there, although I always prefer if they say or representative. But the director of the Bureau of Standards, as a member of the board, that is very good. But I think Section 52(1) speaks to the appointment of inspectors. And although the bill, and I'm sure the through regulations, we will set the requirements for certification and accreditation, but the appointment of the inspectors, it seems to me it would be a useful exercise for us to connect that inspector to the Bureau of Standards. I'm not necessarily saying it should be somebody on Bureau of Standards, but it would make more sense economically. It creates an opportunity, of course, for young Dominicans who've studied medical technology and those who have invested, or the state have invested in them, to get qualified in these fields, to develop a career. That is good. We have a number of young professionals at the Bureau of Standards who, over the years, have become competent in their field. Even the former acting director, officer in charge, is now with CrossQ, which is a credit to us. She spent her years here, and I congratulate her on that new appointment. But it is an opportunity for us to get young Dominicans to develop their professions in medical technology, looking at standards, certification, testing. Testing is very important. And that is going to be very, very, very important. You want to ensure that when you get the results of a test from a lab, it is what it says it is. We cannot have errors in that. If you have a disease, you need to know that this is what you have, and you need to know this is the right diagnostic. I mean, it has happened. There are accidents, but we have to ensure that we minimize the chance of those things by ensuring that we have the right standards and certification and eventually accreditation of those laboratories throughout Dominica. And this is why, Mr. Speaker, I commend once again the Minister of Health and the Ministry of Health, and of course our Legal Affairs Committee for the work that they've done, chaired by, well, he's clapping for himself, so you know who's the chair, chaired by Minister Blackmore. I want to thank you for the work that you've done in this, and the Attorney General and the other members of the committee who have worked on this for a while together with the Ministry of Health. And I, therefore, have no hesitation in supporting this bill, the Medical Laboratories Act. Thank you, Mr. Speaker.
Yes, Honorable Roy.
Mr. Speaker, I really not come prepared to contribute to this bill, but after hearing Minister Henderson, he mentioned Bureau of Standards like around 8 times. 8 times. And I being a former staff of the Bureau of Standards and also served on the Standards Council when I left the Bureau of Standards. And also formerly trained in laboratory quality management systems. And also trained in ISO 17025. That's the quality management system for medical laboratories. It would be remiss of me not to lend support to the medical laboratory concept. So Mr. Speaker, that is a progressive move, because we discussed standards and certification, in the early 2000s, when we were really hot on that. And we never saw results like what I'm seeing today. So that's progressive. And I will commend the Ministry of Health for bringing this bill to the House. But I just want to share some advantages with the House on the Medical Laboratory Council, what it can do for us as citizens and the benefits to the larger society. So in terms of standardizing the practices, we're looking at quality assurance, Mr. Speaker. So that council can ensure that the lab provides accurate and reliable results when we go for medical testing. Because there are clauses in there that gives the council the power to monitor to ensure that happens. Some of us, we may have done some tests here, we get results A, and sometimes we go overseas in lab B and get a completely different results. That is because of lack of standards across the medical system, medical laboratories. Not just in Dominica, but it's a regional issue, me doing some work in the region. Because of countries may have more sophisticated equipment, they have better trained staff, and of course the interpretation too of the results is also a critical thing to watch. So the quality assurance is a critical component of the functions of the council. In terms of regulation of equipment and techniques used, that is very essential, because if you don't have up-to-date equipment, as I just mentioned, because the system and the laboratory and medicine evolves, you have to have up-to-date equipment that can give you more precision reading in order to have proper diagnosis. And based on what I've read quickly on the council, on the bill, it gives them the latitude to ensure that's in place. In terms of credentialing and professional development, that's where we look at licensing and certification. I'm one person who believes in certification. I built a whole system, was looking at bureau standards, do countless training across the globe. So I tell you, without that, it doesn't make sense you don't test for anybody. So saying that the council will have the powers to ensure the labs are certified, we cannot ask for more than that. Because you ensure that the readings and the results that you're given, it's up to international standards. So that's a function that the council has to take very seriously. Continuing education. Dr. Henderson mentioned it in his previous presentation. You cannot be a laboratory technician and just agree you stop training. No. The council have to ensure that there are continuous training, because you have new equipment on the market every year. You have new diagnoses, new diseases, everything just keep growing, so you cannot just stay there in your old ways and not develop yourself personally. So training plan and advocating for training has to be very high on the agenda of the council as well. Ensuring public safety, I just mentioned that. The accurate diagnosis. We need accurate diagnosis, because if you have wrong diagnosis, you can be treated for something that you don't have, and that can even lead to more complications. Okay? So from what I've read, I see that the council can influence that based on systems they can promote and put in place. In terms of complaint and disciplinary procedures, it gives us now, as civilians now, the right to file formal complaint if you're not satisfied with the services provided by the lab. And based on what I saw, the council can have various subcommittees that can look at different aspects of laboratory testing. So even for complaint mechanisms from Dominicans or whoever who's benefiting from that, the system they set up for that, and that's very important, the council has to look at as well. Inspection and auditing, Dr. Nelson spoke about the auditors and inspectors. That's critical. They too need to be trained. So we should have a cadre of trained personnel going across periodically. I guess the council will set the time frame, if it's annually or biannually, they go around, check the equipment, check the quality management systems, the documentation, the records, to make sure that the services are provided is top class and of international standards. Public confidence and trust. That's another thing that's critical. I mean, somebody working at the lab cannot just divulge my personal information to somebody. So systems must be put in place and monitored strongly by the council to make sure that we as civilians, our information confidential, and that we have trust in what we are doing. In terms of collaboration with other entities, that's very critical. that you can have peer-to-peer review. Lab foreman can decide they can have a peer-to-peer review with from trader to ensure that the practices are in line with best practices, and we can learn from each other. But importantly, Mr. Speaker, is when we're looking at in terms of emergencies and guidance in crisis situation, we also what we went through COVID-19 pandemic. We were searching and bouncing our heads where are we going to get equipment for testing. So what the council can do in terms of crisis, they can ensure that the public health response in accordance with best practices. It's not that we're busy and we're in times of crisis that we're going to do things vai. That's where the council can step in and make sure that the tests are done accurately based on international standards and persons that are treated get the best results from the lab. So the functions and benefits from that laboratory council is very, very critical for the health systems in Dominica. It protects us in ensuring that we get proper diagnosis so that we can be treated properly, and of course, maintain the health of Dominica. As someone said earlier, the health of the nation is the wealth of the nation, right? But I don't want us in the house to take it just like another bill. That's a very progressive move. I'm not too sure how many islands in the region who has done that as yet. Minister, you may have to help me on that. But I think we're stepping in the right direction, and we can only get better than that moving forward. So, Mr. Speaker, so with these few words, I just want to support my colleague, Minister of Health, and support this bill with no reservations. Thank you very much.
Yeah, Dr. McIntyre.
Mr. Speaker, I just want to rise briefly to give my full support to the Medical Laboratories Bill. And I want to compliment the Minister and the Ministry of Health, as well as Honorable Blackmore, Legal Affairs, for the bringing of this bill here today. I think it's a very opportune time, considering the amount of labs that we presently have in the country, functional labs. I remember when I started practicing, it was just the Princess Margaret Hospital lab. And then after we got La Falaise, we got Adams, we got Triage, we got Quality Diagnostics, we got Medicus. So we have in excess of maybe 7 or so labs, private ones. So I think it's a very opportune time for such a bill to come to the House. What it really seeks to do is to standardize lab operations in the country, which is essential, obviously from the point of diagnosis and so forth. But it goes a little further as well, because presently you have to look, this is all part of the resilience of health. And the resilience in the sense, you saw what COVID-19, how it exposed even the more developed countries. So you can imagine for developing countries, how significant this is in terms of our resilience in health. So the lab forms a very critical part, and COVID-19 sort of exposed this pretty much to a very large extent, and the entire world recognized how important the labs and the whole operation of labs and the whole training of lab technologies came into place. But to this particular act, it even becomes more significant now, because there are very few centers in the region that you can get a BSc in medical lab technology. Medical lab technology is totally different from just a BSc in natural sciences. It's a totally different environment you're functioning under. So sometimes people may graduate maybe in biology or physics or whatever the case may be and think that they can work in the lab. Two different ballgames. Medical lab technology is a different ballgame to the normal functioning of other labs. And that becomes more significant now because at our state college next year we'll be offering a BSc in medical lab technology. Guyana has a program, Grenada had a program, but it wasn't accredited. So maybe in the OECS, this might be the first country in the OECS to bring a BSc in medical lab technology. And so this comes in this piece of legislation which the minister has brought in, it fits in perfectly with that bigger picture that we have. The first cohort will be just Dominicans, and then after that we'll open it to other OECS people. So this is how the Ministry of Education with the Ministry of Health, this is the impact it's going to have for Dominica and the entire OECS. As to other countries, yes, St. Lucia have passed this act already, and some of the other islands are in the process of doing this. But this is a real forward-moving piece of legislation, and that falls in very well with the BS, the Bachelor in Science of Medical Lab Technology, which is going to be started at the State College. So I think this is really a good timing for this piece of legislation. And I want to commend the Minister on this as well. And Mr. Speaker, it's important to note that this piece of legislation is important for the accreditation point of view. The hospital will get accreditation, but the lab must be part of the whole process of getting our hospital accredited. So well done, Mr. Minister.
Thank you very much, Honorable McIntyre. And I also wish to commend you very highly because we had the OACS regional project, and in the initial thinking and workings, the conceptualization of this project, that it was deemed that the way to go was to have training opportunities for some of our medical technicians to pursue that training abroad. And it was in that time, in that moment, that it was conceived by the then Minister of Health that we possibly had the opportunity to do it here in Dominica. So it's in that thinking, that mind frame, that this idea was born. So I'm very pleased to follow up on this, Honorable Dr. McIntyre. I want to assure the public that while there really was not debate on this matter, just to assure the public that that is the discourse, the discussion that occurs within the walls of our cabinet. And while the discussions are sacrosanct in there, but just to assure everyone that what you see here today in Parliament is what goes on every single Tuesday in cabinet. We take the matters of the public very seriously. And, when I look at this side and I consider the contributions and the tremendous training and experience, you see it coming forward, you see it materializing. And regardless of the subject matter, whether it be health, you could have, Honorable Roy speaking, or anyone, you could have, someone like Dr. Henderson, a legal mind, or anyone else. This is what we have on this side. It's a firm team, a solid team, Mr. Speaker, and Dominicans can feel safe that we have a solid team that will put forward and present regulations and laws and bills in the interest, Mr. Speaker. And not only that, it is the same team of tremendous depth and tremendous experience that also demonstrates and shows absolute compassion to the underserved people of our country. So that is the versatility and the completely formed human beings that we have on this side. And I'm absolutely proud to be working with people like that. Mr. Speaker, in September of this year, as a matter of fact, for the last year, I've been serving as chairman of COSOD. That is a body of CARICOM. So I've been chair of the Ministers of Health, the Council of Human and Social Development. And it was in these discussions that I can assure you all that we've been having at the highest level discussions on accreditation and licensure and so on to ensure that we improve the quality of care for our people. It was up there as well while we had the directing council meeting of PAHO, Pan American Health Organization, that I had the opportunity to speak with them and to get the assurance that they will continue providing us with support for accreditation of not only our hospital, but also for the National Medical Laboratory. So we have that assurance for PAHO that they will continue to support it and continue to finance it. So for that, we're indeed grateful. And they were here just a month ago, as a matter of fact, to continue their exercise with the audits and so on, and we have already been benefiting from that. Mr. Speaker, I want to thank many people who have assisted us in this process so far. We have worked very closely in the past years with the Caribbean Medical Laboratory Foundation, They have provided tremendous support, and I know that they are looking today, and they will be extremely pleased that we are enacting this bill here today. I wish to thank also Mrs. Catherine Jemmett, the previous lab superintendent, and Mr. Eric Carbon now, and also all the wonderful staff at our national laboratory who have provided support to us. Thanks to all the staff of the ministry and to all of you who have contributed today in this debate. Thank you once more, Mr. Speaker.
This concludes the debate. It has been moved and seconded that the bill shortly entitled Medical Laboratories Act 2024 be read a second time. Those in favor? Those against? The ayes have it.
Medical Laboratories Act 2024.
The bill will now stand committed to a committee. The bill shortly entitled Medical Laboratories Act 2024 passed the committee stage without amendment. The question is that the report of the committee on the bill be adopted. Those in favor? Those against? The ayes have it.
Mr. Speaker, I move that the bill shortly entitled Medical Laboratories Act 2024 be read a third time and passed.
Seconded.
It has been moved and seconded that the bill shortly entitled Medical Laboratories Act 2024 be read a third time and passed. Those in favor? Those against? The ayes have it.
Medical Laboratories Act 2024.
The bill has been read a third time and passed accordingly.
Mr. Speaker, I move the second reading of the bill shortly entitled Dominica Hospital Authority Amendment Act 2024.
Seconded.
Mr. Speaker, I address this honorable House regarding the proposed assignment of the Dominica China Friendship Hospital, previously known as the Princess Margaret Hospital, and the new Margaret Hospital to the Dominica Hospitals Authority in compliance with the Dominica Hospitals Authority DHA Act. Back in June 2021, the Cabinet approved the Dominica Hospitals Authority Bill, which was subsequently enacted in Parliament as the Dominica Hospitals Authority Act. This legislation laid the foundation for establishing the Dominica Hospitals Authority, empowering it to manage hospitals and related healthcare facilities effectively. Under this act, the authority assumes the essential responsibility of overseeing the overall management and administration of these institutions as determined by the Minister for Health, Wellness and Social Services. Significantly, the Act transfers all financial obligations, rights, privileges, and liabilities associated with these facilities from the government to the authority. Hospital facilities do not merely represent structures and buildings. Instead, it houses medical professionals and patients. They are vital lifelines of our communities. Mr. Speaker, the intricacies involved in managing a hospital, and in this case, I speak to the striking the right balance between delivering quality care and ensuring financial viability and meeting regulatory standards. These demand a governance structure that promotes accountability, strategic foresight, and operational excellence. The establishment of the Dominica Hospital Authority is intended to fulfill these requirements. As a governing body, the authority is entrusted with holding the administration accountable for its operations and decisions. It guarantees efficient resource management and equitable policy implementation. Through systematic reviews and audits, the authority promotes transparency, cultivating trust among patients, staff, and the broader community. In the rapidly evolving healthcare landscape, marked by innovations in technology and shifting patient needs, the authority will convene individuals with diverse expertise to develop long-term objectives and various strategies. It will also ensure that the policies and services provided resonate with the needs and values of the communities served. Furthermore, the authority will oversee crucial quality assurance programs, patient safety initiatives, and compliance with regulations, guaranteeing that every patient receives the quality of care that they rightfully deserve. The financial management of the hospital, including budgeting, revenue generation, and investments in infrastructure and innovation, will also fall within its purview. In times of crisis, the authority is also expected to provide essential and effective leadership guiding our healthcare system through even the most difficult challenges. However, Mr. Speaker, to enable the authority to operate effectively, we must acknowledge that a new payment structure will need to be established for some services that are being rendered. I recognize that this might be a topic that can be sensitive, but it is necessary for consideration. In Dominica, primary healthcare services are generally provided without out-of-pocket cost, basically free, while secondary healthcare often follows suit with heavily subsidized fees. Conversely, those who have sought medical services abroad have experienced costs that are associated with every aspect of care, whether it be most basic, from gloves or the tape that would have been used, or cotton balls. It's all priced, and the patient is expected to pay. And many of these costs, in some cases, are in fact required in advance of treatment. Mr. Speaker, as a matter of principle and for clarity, we will never approach our healthcare here in Dominica from a purely financing or inhumane stance. Never will we do this. As a matter of fact, we will always be remembered as the government who removed user fees here in Dominica. Mr. Speaker, we believe in healthcare equity and universal access to medical care. And that's why, Mr. Speaker, we are therefore, in our actions by our policy, tethered to the United Nations conventions in that regard. Hence the reason why we have our program, 60 and over, free healthcare access, 18 and below, free healthcare access, Mr. Speaker. However, to continue to develop and maintain our expensive and extensive equipment, there must be a requirement for those who can pay to pay, Mr. Speaker. This is how we will move towards more modalities of imaging. And Mr. Speaker, in this case, I'm not speaking to basic healthcare, but we have morphed, like you have heard, Mr. Speaker, to providing various modalities, from in the past having only X-ray, where this department was called X-ray department in some cases, to now being called imaging department, Mr. Speaker. Because we not only have many X-rays, Mr. Speaker, we have mobile, Mr. Speaker, we have CT scan, we have MRI, we have fluoroscopy, we have mammogram, we have ultrasound, Mr. Speaker, transesophageal echocardiogram, you name it. This is where we are today, and we have to maintain this equipment. Many of these equipment require expensive maintenance contracts, Mr. Speaker. And in order to continue to provide quality and state-of-the-art care for people, we must have our equipment available always. Mr. Speaker, in order for us to move forward into the times, in order for us to use fully and completely the staff, the specialists that we have at the hospital, and I speak specifically to our cardiologists like Dr. Andrew, and even we have a young one who just came back, Dr. Reef, and our vascular surgeon, Dr. Abel Seaman. We require new investments to ensure that the areas in which they have been specialized in and the surgeries that they have been trained to perform can in fact be done here in Dominica. We need additional investments. And to do so, one of the areas that we would like to look at would be a catheterization laboratory. And Mr. Speaker, to do so, it must be financed, Mr. Speaker. We have to help the hospital to help itself. Mr. Speaker, to facilitate this full transition to the hospital authority and to enact the necessary financial, administrative, and operational structures, we must officially transfer management to the authority and repeal the previous Roseau Hospital Ordinance. Mr. Speaker, this assignment is critical for enhancing the overall functioning of our hospital and our healthcare system by entrusting the Dominica Hospitals Authority with the management of the Dominica China Friendship Hospital and the new Marigot Hospital. We are not only ensuring efficiency in governance, but also reinforcing our commitment to delivering better care and better care outcomes to our people. Mr. Speaker, with these few words, I commend this bill to the House for debate. Thank you.
The bill is before the House for debate.
Mr. Speaker,
Yes, Honorable Henderson, proceed.
I stand out of duty, and I hope I have something sensible to say on this matter. Sit down there. Mr. Speaker, the Dominica Hospitals Authority Amendment Bill, which is before us, seems to be a simple matter, but clearly with fundamental impact on the way we operate. Although one could admit that, in effect, we have been operating under the hospital authorities, that is to say the Dominica China Friendship Hospital, and now the new Marigot Hospital. But this is a legal requirement to allow the hospital authority to do some of the things which are required to truly transform the delivery of services at the Dominica China Friendship Hospital and also at the Marigot Hospital. But Mr. Speaker, I think it's important to just take a few minutes to reflect on what has happened, that transformation in the healthcare services that we have witnessed over the last few years with the construction of two major hospitals in Dominica. And especially the Dominica China Friendship Hospital, with the type of equipment that we have never had in Dominica before. The type of services that are being delivered that we were not able to deliver before. I used to remember years ago, I used to say to friends, boy, a little cool wash you get on your head. If you can't reach Martinique or Guadeloupe in time, yourself, you don't even know, you might not make it. But now, and for a while now, the Labour Party has transformed medical healthcare services in Dominica. I remember when we established the first ICU, the intensive care unit. And I remember my partner, there at St. Joe, he died and he came back. You know, Cartier went to ICU and man had agreed, you know, Cartier gone. And I passed him on the other day on the road walking strong. He went through the ICU and thankfully they were able to help him to recover. And today he's in good condition. So that's the kind of transformation that we have seen. But one of the things that we forget when we see those things is that we run a hospital before, you know, maybe a few fans there, keep you cool. You know, we're grateful for it then, yes. But now we have air conditioning. I don't know if people are thinking of that. At your homes, you know, you might not even have air con, and if you have it in your room alone, you turn it off and you keep it on a little time when you're feeling too hot. But this thing is running 24/7. I'm saying this to say that the cost of operating just the Dominica China Friendship Hospital, I can take a chance and say it has doubled. It has increased significantly. We have more specialists than we ever had before. When we grew up, well, you guys are so young. Jeez, boy. Wow. Blackmore, help me out. When we grew up, you know, back then you had a little, by the way, we used to have a doctor from Switzerland, you know, in St. Joe. Or was it Sweden or Switzerland? And they used to call him Dr. Pushin. He used to always wear little slippers. You know, little Pushin. So he used to call him Dr. Pushin back then. That's a white man. You know, I mean, Think about it, growing up. The first doctor I saw that looked like me was Dr. Pascal in St. Joe, when he came to St. Joe. I'm serious. I didn't know black people could be doctors. I didn't know local people could be doctors. Dr. Soren, and Dr. Grell, and you see those people looking, I mean, I wouldn't say it, but we know it. Dr. McIntyre, we know it.
Big names, big names.
But then when you look around you, even St. Joe in the back street where you have to pass by my grandmother's house in the back to go behind by Shupa and them, his niece is a doctor now, Dr. Joseph, and a very good one at that. I'm very, very pleased. My little cousin, Ocho Bando, I used to go by her grandmother and say, neighbor, paddy say, but you have a little sugar, no? Don't me. She's a doctor, training in China, my cousin. So all of us have stories to tell you, turn around, and you can see that. So we have so many doctors now, so many specialists. Dr. Williams, we have Dr. King. We have so many of our locals who we have trained, and thanks to Cuba, as we were thanking them yesterday, for assisting us in that transformation. So the operational cost of the hospital is not only more complex and require more personnel, but the actual economic cost of just operating that facility has increased tremendously. Just to keep the lights on. Just to keep the lights on. So imagine now having to finance the operations and maintenance of those equipment that we have. You heard the minister said it, and he learned those words well. He said it well. He even talk about modalities. But if you send your partner, would tell you guys as a sakisa. So we have come a long way. It's a tremendous cost. And we have to appreciate the fact that it is now more costly to offer medical services than it used to be. And this is why sometimes, don't get upset with me, but I don't know why we are hesitating to have, in a very holistic way, I'm not saying to arbitrarily increase fees and impose fees, but we have to consider the financing of medical services, medical care in Dominica. We have to consider that. And earlier when we spoke about the bill to regulate laboratories, medical laboratories, I mentioned the fact that people have now accepted the fact that they will go to private labs and pay their fees. And they're doing it because those labs are thriving. So there is an appetite and an ability to pay for healthcare services. And in every country, no matter what the system of government, there is a way they pay for it. So either if you're living in the UK or in Canada, or most of Western Europe, you pay high taxes. You don't pay for medical care. Generally, it's free. The state provides it for free. But you pay for it somehow. In other places, even when we saw Obamacare in the United States, they created a system where the state would contribute some and they reduced the pressure and the burden on people because they could buy insurance. So let's move to insurance. Dr. McIntyre, I think it was last year or the year before, when you presented the budget, we took a very progressive step, or steps, as far as insurance is concerned. One, for resilience building, we offered rebates on home insurance. And as an extension to that, we also offered a rebate on health insurance. But I'm not hearing us talking about that. We should be encouraging people to buy insurance, those who can afford it, because they get a rebate on their premium back at the end of the year when they file their taxes. So it seems to me that all of us who pay taxes should buy our own healthcare insurance and file for a rebate. But our healthcare system must create the opportunity for people to immediately build their insurance. We can't be, subsidizing healthcare for people who can afford it when we have created a mechanism for them to claim on their insurance. We have to promote that. We have to transform the healthcare system so that when we require to replenish our inventory, we will have no difficulties doing that. When we will need to service those equipment, and it's not difficult, because if you talk, to some of those labs, they'll tell you they may pay $45,000 a year, or whatever the fee is, to make sure somebody somewhere in the US can have a look into their equipment and know whenever there's a problem and can service it for them so quickly and bring the spare parts down. I mean, we have a direct flight to Miami. We have Minister of Tourism, welcome back. So that is not like a long time. You can even go for it and come back. So we now need to create the opportunities for us to finance the operating of healthcare services in Dominica so that we can have the more reliable delivery of service. But the other thing that, again, and personally, Minister of Health, I would not be shy to say when I do have something. I don't know why we're afraid. I'm not going to take issue with people running the hospital if they say they do have something to go easy on the things, save it for emergencies. What's wrong with that? But that's done all over the world. All over the world. I don't know why we always feel like we have to be afraid and run and hide and things. That's how people always give you blows. No matter what you do, people give you blows. I mean, it takes a time to get to the threshold. I reach that threshold, myself just do my do melee. It doesn't matter to me. Myself, I want to do what that makes me happy. I do what I want. And I say what I want to, wherever I want. So maybe some people have not gone to that threshold. But if you do have medication, tell people to have medication, I'm going to get it just now. Straight. But it's true. And we have to say those things. Because I just came from seeing my sister in New Jersey. My sister had surgery. And she works at the hospital where she had the surgery. And she told me there are times they have to cancel surgery because they don't have medication. They have to get permission to get IV fluid. They had to extend the use of their mask because they were low on supplies. And these are things they announce. They tell people that. I mean, albeit there are several hospitals you can go to in the case. But I believe we should get to a stage where we need to have a mature conversation on financing healthcare services. And don't go and run and hide every time people accuse us of not having something. Because there's never been a time where we have run out of critical supplies that we have not replenished quickly thereafter. The minister has sometimes to call his colleagues in the region. The Prime Minister has sometimes had to charter a flight to bring the thing. So we get it done. Albeit, we need to improve the system. So we know, and I know you said recently we had a PPS came and we did the inventory, we did the assessment, and we've made some significant improvements, and we have to continue on that path. But we need to have an honest conversation about financing healthcare. Healthcare is expensive, and it's getting more expensive. Those who can't afford it will take care of them. That's the Labour Party brand. That's the Labour Party brand.
Thank you.
We have put in place free healthcare for those below 18 and those above 60. But we have to ensure that even in my view, within those categories, there are people who may have insurance. Why not build insurance? So that we can improve the delivery of services. And it is about time that we have that conversation. And I really look forward, Minister, I heard you started the discussion, or you introduced it, and I want to urge the board to look carefully, of course, the Minister must approve, but to look carefully at how, and advise the Minister on how we can sustain the financing of healthcare services at the Dominica China Friendship Hospital in particular. While I'm on that, I want to thank the members who served, especially my good friend from St. Joe, Eliud Williams, together with Jennifer Asifang, Dr. Dr. Peters, they did quite a lot of work in the early days as they were seeking to introduce the hospital authority. And now Dr. Daru is on there as the deputy chair. I know it's not an easy task. And I also want to recognize the work of those doctors, nurses, and the staff of the Dominica China Friendship Hospital, especially those who have really lived up to their profession and continue to provide excellent healthcare services to the many Dominicans and visitors who find themselves at the Dominica China Friendship Hospital. I know it's not an easy job because the only reason someone would come to you at the hospital is because they have a problem. And any one of us who have anybody we care about who is at the hospital, we would not be in a good place. So it is not an easy job that they have, especially if it's a matter of emergency. So we have to understand that. But it is time that we move to a new era in our development. The Dominican Labour Party, we've made the investments, we've put in the facilities, we've trained people, because a lot of talk was also about, oh, we're just concerned about building hospital. I remember back then. But no, we've trained our people. We have more training to do, yes. We have to develop the full length of services to tertiary care in some departments, as you heard the minister, especially in cardiology. We get it there. But we have to, as Dominicans, take on the responsibility, because when we go to the US, we pay. We pay. And it's not easy. And we have to be prepared to make our contribution. And as I said, and I will say it again, lest I be misconstrued or misunderstood, that the Dominican Labour Party will stick to its brand to take care of those who can't afford. But a system must be created where those of us who can pay, we pay. And the system will facilitate the payment by creating the mechanisms for us to pay, as they have in some respects. But we have to expand that, because healthcare is too important. Every one of us will need to go to the Dominica China Friendship Hospital at some point. And we all want to be ensured that we can get the best healthcare services possible. I support the amendment, and I commend the Minister of Health for moving to get things in place to continue the improvement of the delivery of healthcare services in Dominica.
Yes, Honorable Blackmore, you may proceed.
Mr. Speaker, I must say a few words on this very important measure before this Honorable House. And it's an honor for me to speak after Dr. Henderson, a good friend of mine. Mr. Speaker, I believe we have to look beyond this proposed measure. We seek to give legal force to the hospital authority. And the question is, Mr. Speaker, I may want to ask you, how did we get there? And what are the implications of what we are seeking to do? Mr. Speaker, very often within our cultural makeup, it is part of our psyche to complain about the things we do not have. And very seldom we speak about the things that we do very well. Mr. Speaker, I believe that the rebirth of Dominica, from a socio and economic standpoint, started when a very bold and decisive move was made by then a very young Prime Minister. And at the time, it was questioned. You may recall that when he went to China, along with Senior Minister Osprey, and spent a very long period of time negotiating, and out of that discussion came the 4 pillar projects. One of it was the construction of a new hospital. And there was a big hoopla within the voices of the detractors that this hospital would never have been constructed. Can you recall that, Mr. Speaker? Songs were being made. Even when the construction was in full force and manifesting itself on the ground. I want to take this opportunity, Mr. Speaker, for you to really extend our gratitude to the government and the people of the Republic of China. Peoples of the Republic of China, sorry. Because, Mr. Speaker, that building that you see in your former constituency, to me, I've traveled and I have not seen a hospital within the OCS catchment as beautiful as this structure. We're going to saw me. And Mr. Speaker, when I spoke yesterday and I made reference to our strategy, which has up to 2030 to actually meet certain goals. And in that strategy, we're speaking about the healthcare of our society. Because a society cannot emerge if the populace is not healthy. So, Mr. Speaker, let us talk about the graduation of the healthcare system in this country. So apart from what you're seeing there, in every major district in this country, we have modern healthcare facilities, Mr. Speaker. What does that mean? And it means, therefore, you have less strain on the major health infrastructure in the country. In many countries in the Caribbean, Mr. Speaker, you hardly have health centers in every village. What that means, therefore, every little incident you have in those communities and hamlets has to be referred to the major hospital. We don't have that in Dominica, Mr. Speaker. It's because of the cloning that is taking place in arriving where we are today, Mr. Speaker. You can recall the days my sister was a nurse, and she was part of the primary health care drive in this country with Dr. Etienne and Mrs. Blanchard. I can recall that. The member for Rosenhoff, mom. These people were very passionate around the country, Mr. Speaker, to the extent to which Dominica had the best primary health care system in the whole Caribbean. It was a model, and maybe it still exists. But in terms of our secondary and tertiary healthcare system, that had to be addressed, Mr. Speaker. Now, in order to get to that level, to the tertiary level where you have specialized care, you must have one, the building, the proper structure, and secondly, the infrastructure, the equipment, sorry, and thirdly, and even more importantly, Mr. Speaker, the specialization in the various medical disciplines, Mr. Speaker. That is what we're getting. So we are now referring less people to overseas for specialized care. Because we have that now in Dominica. They're not talking about it, you know. People go in and they're getting the procedures done. The same day they're at their homes. The same day at their homes. It is because, Mr. Speaker, we're getting to the point of specializing in critical procedures, Mr. Speaker. That is development, Mr. Speaker. So we don't only come in there, Mr. Speaker, with a bill to create or to give force to an authority. But you can only give force to an authority to manage something. If you do not have anything, there's no need to have a structure to operate it, Mr. Speaker. So when I hear people talking, Mr. Speaker, and they have been speaking a lot, that, you know, whenever you go to the hospital, that, you come back alive. Mr. Speaker, let me just say that in the most developed economy of the world, one of the highest cause of death is medical malpractice. Medical malpractice. I'm not going to call the country name, Mr. Speaker, but I'll say the most developed country in the world. You got my point. So if we're just starting our experiment in Dominica, which is emerging, there'll be gripes, Mr. Speaker. But I can say to you, Mr. Speaker, for what I've seen, and I know people coming from overseas to Dominica to get medical attention. They're not talking about that, Mr. Speaker. And in the history of Dominica, I can say so with no reservation, this is the best our healthcare system has been in the history of Dominica, Mr. Speaker. With no reservation, Mr. Speaker. And then you tie that to caring for the people. Caring for the people. In which country in the Caribbean? I heard the minister spoke about the National Health Insurance Scheme, which is important. And that is something the Prime Minister has been advocating in the Labour Party administration. We have to get to the point in our development as a people where those of us who have more must be willing to pay more to care for the less fortunate. That is the way that a national health scheme can really operate for it to be effective and to act for it to achieve its intent. Do you get my point? And that's why a number of people had an issue with what they call the Obamacare because he was a black man. But over 40 million people who would have been left without health care are covered under that. So we have to get to that discussion from a national standpoint where we put aside our selfishness and recognize that if we're blessed with more, we must be willing to care for those who are less fortunate. And for a national health insurance scheme to work effectively, we have to have that understanding within our psyche. Those of us who have more can pay more, Mr. Speaker. So, Mr. Speaker, I support this measure, but I wanted to just say that, Mr. Speaker, that we have been a long way in our fight to ensure that everyone, irrespective to who you are, can be provided for within our healthcare system. Before we took office, people used to be scared to go to the hospital. They stayed at the homes and they died because they didn't have the money to pay the hospital user fee. Can you recall that? People used to stay home. Now, there is a particular person now. You have a new song out because the Calypso season is on. So I get all those new tracks listening to me. But it started boom and scary. But they were just at the hospital there, and when he was discharged, he doesn't want to live, he don't want to live, you know. He said, I'm still feeling sick. Because the services, you understand, that he was receiving at the hospital, he was amazed by that, to the extent to which when he fell ill and he was hospitalized, his family members were concerned about him, hearing any things about Dominica, once he go to the hospital. And when they came down to see him, the boy said, boy, scared all the way. I'm so happy at the hospital, I don't want to leave. The hospital is clean, Mr. Honorable Minister for Health. Very clean. And people are well fed, Mr. Speaker. And that is what the Labour Party is all about, Mr. Speaker. Yes, we have problems. Yes, we need to work harder. And that is what we're doing. But we must give fact. And we must celebrate the gains we have made and what we have as a country, Mr. Speaker. And our healthcare services in this country is graduating to a higher level. And that is what we mean when we say that we're taking the country to a next level. And to do that, healthcare, education, housing, road infrastructure, and the list goes on, Mr. Speaker. So that has to be tied within the whole menu of the things that we're doing to develop the country, Mr. Speaker. And I support this measure. I support the Minister for Health. And again, we can only give support to something that we have. We cannot support something that we do not have, Mr. Speaker. So all of them, for matter of fact, and I'm going to say it there. I'm going to say it there because you see me right now. I mean, I praise God. You understand? So there's nothing I'm scared of saying. I may not say it for a particular reason. But I want that particular person. He said to me that I think that my brother not going to get himself involved in any more demonstration anymore. You understand? Because of the treatment he got at the hospital. The same hospital say that when he go there, they die, you know. Because he was not able to see light in a particular eye. And then they were able to diagnose something, I'm not going to say it then. All of us can get sick, you know what I'm saying?
Yes, what's your
And
trend?
then-
What's your trend of?
Yeah. Now,
Yeah.
yeah, sorry.
Especially medical matter and
I'm
personal.
not going to say it, I'm saying. So now that, Mr. Speaker, that at the same hospital, the procedure was done, and it's seeing like better than me, and I have 20/20 vision in both eyes. But if it's seeing like better than me now, Mr. Speaker, it means therefore that something would happen. And he's praising the same Chinese doctor, he's saying they're the best, Mr. Speaker. So we have specialists, eye doctors, who are in Dominica, assisting us, Mr. Speaker. So in every aspect, in every dimension of our healthcare system, we are actually providing the services needed. And I have not heard them spoken about, Mr. Speaker, at the end. And that's one thing that the authority is getting under control. There was an issue with our maternity ward. If I'm subject to correction by the minister. And I'm now learning that is now, they have shifted, the patient is not so, and they're now refurbishing that area. Nobody's saying anything about that. But you hear a big cry about our infant mortality rate. What does that mean, Mr. Speaker? When that is properly done, it means that, therefore, Mr. Speaker, this is a government that is concerned, that knows what it's doing, and there's a plan to actually achieve our vision of ensuring that every Dominican, irrespective of a social class, has the right, not the privilege, to healthcare, Mr. Speaker. And that is our goal, and that is the mandate of the Labour Party. I thank you very much, Mr. Speaker.
Mr. Speaker, I rise to give my support to this bill by Honorable Minister for Health, Laville. Mr. Speaker, it is a very good day for health in Dominica, followed by the pharmacy bill and the laboratory bill. Now we are having a very progressive bill to have the Dominica China Friendship Hospital and the Marigot Hospital being managed by the Dominica Hospital Authority. Mr. Speaker, as we know, healthcare has come, like I said before, and as all the other speakers before me said, a very long way, Mr. Speaker. But as it is moving forward, Mr. Speaker, we have to move with the trends, and we have to put things in place to manage the healthcare of the people, Mr. Speaker. The hospital authority was put in place in 2021, as Minister Laville said, and they are given the mandate to manage the Dominica China Friendship Hospital and the Marigot Hospital. But Mr. Speaker, not only that the government has put the authority in place, they have equipped, like I said, the hospital. And with so many equipment and with so many diagnostic tests can be done in Dominica. And the people that are over 65 are getting it for free. Those that are 18 and under are getting free health care. And like was said before, there are some people well within that range that could afford to pay. However, they have been overlooked. So it is only fair that those that are able to pay can pay. And Mr. Speaker, if you remember, there is an eye clinic, an eye center at the Dominica China Friendship Hospital, which is of international standard, Mr. Speaker. And I was told by the minister that it is going to be set up as an Eastern Caribbean OECS center for eye care, where people from the other islands could come to access eye care in Dominica, Mr. Speaker. And this cannot be going unnoticed, Mr. Speaker. Mr. Speaker, we have a diagnostic center second to none. As was said before by Minister Laville, it was only X-ray department before. But now, you could go there and get diagnosis on a number, I wouldn't call them, Mr. Speaker, because we all know them, Mr. Speaker. At the lab, Mr. Speaker, Dominica, we must remember, was the first country in the Caribbean testing for COVID-19. since during the chikungunya and the Zika outbreak in Dominica, the foresight of the Ministry of Health then realized that because of emerging diseases, we have to find our diagnostic centers to test for those diseases. And when COVID came around, we already had our equipment to test for the viruses. And Mr. Speaker, we are moving forward in health in Dominica, and I think this is a very progressive bill, and I had one choice to support it. So I stand, if this few was to support it.
Mr. Speaker, I stand to give my full support to the Dominic Hospital Authorities Act 2024, because let alone, when you look at how this government has handled the development of healthcare in Dominica. So granted, we've set up the infrastructure part, where we have almost 49 health centers, we have 2 state-of-the-art hospitals, but that's just infrastructure, which doesn't exist in other OECS countries. Mr. Speaker, the minister did make mention to that. Not only that, with the health districts, where the nurses, the doctors, everybody is resident in the districts, which also tells us about our resilience in health, unlike other OECS countries. So that's a major difference with us, that the teams are stationed within the districts. So in the case of any eventuality, you don't have to be transporting people from other places, they're already stationed there. And this is, these are all remnants of the primary healthcare system we had before. This is exactly why Dominica managed COVID the best in the Caribbean, because of the remnants of this primary healthcare system that we had all along. So it's still continuing, and that's the benefit of this as well. But let alone the infrastructure part, Mr. Speaker, in all the investments we've done into equipment, as Honorable Edward said, we were the first to do COVID-19 testing in the region, and that is just the foresight that the government had in terms of our resilience in health. But even in terms of the human resource, which is critical, and then now with all our specialists coming back. So it just tells you the planning that's taking place so that we can have a really efficient and a proper healthcare system. But Mr. Speaker, where this Hospital Authority Act comes in, that's where the administration and the whole running of the entire healthcare system comes in. And I agree, definitely, financing of health, it's a critical issue. And because all of these services that we're offering, they cost money. And all of these services, you have to appreciate, some of them might be available in other OECS countries, but not at the public hospitals. That is the main difference, Mr. Speaker. You might go to a private hospital, some of those things might be there. But as to having all these services at a public hospital, Dominica is the place where this happens. And this is what the government has been doing, to a responsible government, to making these services available to the people of the country, and not just to those who have insurance and have money. And that point we must appreciate very well, Mr. Speaker. As a matter of fact, Mr. Speaker, just last week at the Dominica China Friendship Hospital, nowhere else in the OECS in the public hospital, we had a contrast MRI, a cardiac MRI. Mr. Speaker, those things cost money, but yet it's done at the hospital, the first at the public hospital in the OECS, to have an MRI done, a cardiac MRI with contrast. So it just tells you the level that this government has taken health to. And I think people should really appreciate the effort and what the government has done for health. So I really support this bill full-heartedly. I know it's just to make the whole administration of the health system even just more efficient. The whole Dominica Hospital Authority bill, which you can turn back, how it deals with the complaints part, how it deals with the licensing part, or so many different aspects of it, to just make the hospitals function much better and more efficient. So, Mr. Speaker, I have absolutely no reservations in supporting this act, the Dominica Hospital Authority Act 2024. Thank you.
Yes, Honorable Pinard, you may proceed.
Mr. Speaker, I rise to give support to the bill before the Dominica Hospitals Authority Amendment Act. But I just really want to commend the Honorable Minister and the leadership from our Prime Minister for the tremendous work that we are putting into the health system in Dominica. it's been a short time since I've been in politics, but one of the things I've come to recognize is when you see the opposition forces really attacking something, that means we on the government side doing something right. They do not attack things that not working excellently or they do not see it going in the correct direction. And the reason I have concluded that the health system in our country has been under such tremendous attack is because it is evidence to everybody what has been happening, the transformation that has been taking place in the health system in Dominica. We have been putting in place the infrastructure. We have probably the highest number of health facilities per population, probably definitely in the Caribbean, and maybe one of the lowest as well in the world. So in terms of the infrastructure, we have been putting that in place and we have been doing an excellent job. We have upgraded our equipment facilities. I actually got to know what a high-flow machine was when I heard that we were having one at the hospital. And we have a range of other modern MRI. I remember years ago, you would have to pay a ticket, travel overseas to be able to get an MRI scan done in either Antigua or Barbados or somewhere, and pay significant sums of money. In Dominica, MRI is the cheapest in the region without any question. So we have put the facilities in place, we are putting the equipment in place, we are putting the human resource, the personnel in place, the infrastructure has to be 360. We're looking at the pharmacies, the other supporting organizations, everything is being put in place to make sure that we are providing excellent health facilities and services to our population. No stone is being left unturned in looking at the health of our people. The Prime Minister, the government has been on a tear with respect to raising awareness of non-communicable diseases in Dominica. We have, in this sitting, we have looked to increase the taxes on sugary drinks, all towards encouraging people to limit their use of those. Again, another dimension at looking at the health of our people. But as has been mentioned, having a modern and well-functioning health system is costly. Health facilities and these services cost money. Medication is expensive. Doctors are not in the lowest paying bracket and so on. So it takes money to build and to maintain a strong health system. And so I am fully in support of the Hospitals Authority looking to make sure that the system remains financially viable. But there's just one thing I want us to note. When we're saying that we have in Dominica, as you know, we have a policy where everybody under the age of 18, everybody 65 and over, have free services at all government facilities. When we're asking for there to be taken into consideration that those with insurance pay for these facilities when they are able to, we're not asking you, the people, to pay. We are actually asking the insurance company to pay. By not having those with insurance pay, we're not giving any benefit to our people. We're giving a benefit to an insurance company that do not need it. Insurance companies have enough money. What we're looking to do is to keep money in the pockets of our people. The Labour Party is very much in terms of helping the lower income person, helping building up the small individuals, to provide the facilities, the safety nets, the social programs to help promote and improve the well-being of our lower income people in particular. By having the hospital authority impose a charge on those with insurance, we are doing nothing against that because ultimately it is the insurance companies that pay. So even if you are personally in a lower bracket person, but you have maybe where you're working, you have medical insurance, the medical companies can pay for that. All these things they can go to, as Dr. Henderson said, keeping the lights on. So my contribution is very short, but I just really wanted to commend the work, the excellent work that the minister and his team is doing with respect to developing and promoting health and the health facilities in Dominica. I want to encourage everybody in Dominica to be very mindful of the non-communicable disease. When you have to take your medication for hypertension, please take it because I know quite a few people that they on medication for hypertension. They go into the doctor, they get in the prescription medicine,
It sits there and then they only paying attention to it when they start to feel dizzy and falling down. You're risking your life. Less than a month ago, I lost one of my uncles because he fell sick. He's just 3 years older than I am. He fell sick and died due to causes related to hypertension. He wasn't taking his medication as regularly as he should. So it's just a matter of continuing to raise awareness, continuing to build the infrastructure, and put everything in place. And all these free bills that were presented here in terms of the health bills by the minister, they go a long way towards advancing us towards those objectives. So again, my full support to this and the other medical bills being put forward. Thank you.
Yes, Honorable Prime Minister, you may proceed.
Thank you, Honorable Speaker. I want to, first of all, commend the Minister for his presentation on the 3 bills before the Parliament. I think that they are important in enhancing health management systems, ensuring that there's better accountability, ensuring that the standards are not only maintained but improved, ensuring that the quality of care and the quality of services which we provide, that there's legislation to support it, and that the patients have avenues within which to make the complaints, and of course the licensing, and to ensure that those entities which provide those kinds of services that are so sensitive have the legal framework in place to ensure that people can maintain standards and follow certain protocols, because health is so important and so sensitive. And so these are progressive pieces of legislation, and I do hope that its implementation and, of course, the supporting regulations that will be drafted will complete the legal framework for advancing healthcare in Dominica. And so these are very important matters to bring to the Parliament. And these matters will only augur well for the health system and for improving the delivery of healthcare into Dominica. And of course, there are other pieces of legislation that are being worked upon, and in the new year, those will be brought on board, so that you have a whole gamut of legislation that seeks to address some of the gaps, because health and every other thing is an evolving situation. As time goes by, you have challenges to confront, and don't be surprised that in the next year or two, we'll come back here to make amendments to this very piece of legislation, because it's a dynamic system, it's evolving and so forth. So it is not static, it is moving, and the emerging challenges, the emerging issues that we have to confront, and of course the WHO and PAO usually will make certain pronouncements and from the ministers of health globally on what they believe that the health system should consider. So all of these things are important. And I think that those pieces of legislation also complement the significant progress we have made where health infrastructure is concerned, and the increase in the delivery of services to our citizens. And I think that somebody needs to take the time, and maybe people keep telling me that when I am speaking, I need to record what I'm saying and have it transcribed as part of the documenting the contemporary history of this country. Because oftentimes we forget what life was, because we get so comfortable with what life is. And the reality is, if we're all honest with ourselves in this country, we will appreciate that this country has come a very, very long way, where the delivery of healthcare services and access to healthcare services is concerned. When I became Prime Minister in 2004, and you know, within the Dynamic Labour Party, when it comes to social programs, education and healthcare are paramount for us. This is why you recognize that when we came into office, we revolutionized access to education. Because we believe that it's important to empower people with knowledge. Knowledge that we expect them to use to improve their lives and improve the lives of the society within which they live. And healthcare. It's important that people have access to quality healthcare and that there are no hindrances or obstacles towards their achieving that desired healthcare services. So when we became Prime Minister in 2004, we had no ICU. Now, as I understand it, an ICU at a hospital is akin to an engine in a vehicle. It's akin to having petrol in a vehicle. And so we never had an ICU in the hospital. When we came into government in 2000, we only had a second-hand dialysis machine. And sometimes it's important for us to repeat this thing because people who are 25 years old and 30 years old and 40 years old and even 50 years old, and because they don't teach us contemporary history in school or at home, we do not know our history. And so there is a movement to give people the impression that we always had those things. It is just that we have less now. Similarly with the direct flights from North America, people give you the impression, when you hear people speak, opposite people speak, as if we're getting direct flights from Africa too. Before this government came into office. So it was a challenging situation. And I understand why some governments never had the ability to address those shortcomings. Because one, it is costly. Two, you must have a vision. You must have a vision. What do you want to achieve? But that vision must also be motivated by your own philosophical and ideological views as a party and as a people. And when you look at this Dominica-China Friendship Hospital, as some of my colleagues have articulated, I don't want to repeat what they've said for the speaker to accuse me of tedious repetition, which is a violation of the rules of the parliament. But I always say, as a self-criticism, that we are not telling the nation, we're not speaking to the nation enough. We're not speaking to the Dominican people enough to telling them exactly what it is that we're doing for them and how we go about doing it for them. And I think the reason why we don't do that, because we're here to serve, and with us, you achieve something and you look for the next challenge to overcome. But when you take time and you look at the hospital, and I hear people criticize the hospital, I can say to you, Mr. Speaker, Honorable Speaker, that the care that people get at the hospital is exceptional. The doctors, the nurses, the orderlies, the kitchen staff, the laundry staff. I mean, exceptional. In everything, you will have somebody who wake up bad at night, who have a full frustration and may say something to you that should not be said to you, and you have those things. But I think we need to start focusing more on the positives. On the positives. On the positives. And while we address the little negatives that may appear, but the reality is the positives are more prevalent. And so, and my colleagues have also pointed out the sheer cost of running this. In one Caribbean country, for example, to do an MRI is $2,000 US. $2,000 US for a basic MRI at a public institution. In Dominica, we're still charging 150 EC. 100 EC. And for you to understand this cost, even if you were to charge 2,000 US or 1,000 EC dollars or 1,500 $, it will not be even enough to cover the cost of providing that service. Far more for 150 or 100, sorry. We have people from the other Caribbean countries flying in now to Dominica to do MRIs. And so it is progressive. You'll always have challenges to confront. Our investments in primary health care. In one shot, build 12 new health centers, health and wellness centers. In one go, 12. The Marigot Hospital, member following from Marigot, PAO has declared this hospital to be an exceptional facility. And this hospital was not built for the next 10 years or 20 years, it was built for the next 50, 60, 70 years. Futuristic, similar to the Dominica China Friendship Hospital. And we place on record our gratitude to the Chinese government. This is not a 20-year-old hospital. It was built beyond our capacity. And we moved from having one theater to only 7. And each of these theaters having a little ICU, so that if you have a challenge, they take you right next door. We moved from having one second-hand dialysis machine to 6. We bought 6 brand new ones, and to now having 12 or 14 brand new ones with exceptional technology. Exceptional technology. And when you go to the hospital, Mr. Honorable Speaker, you will see that all of the equipment we have there are equipment you will see in developed countries. As a matter of fact, some of them may not be even available in some of the hospitals in developed countries. And the quality of the equipment. So the care that we provide health, when it comes to health, Mr. Speaker, I think we have a lot to celebrate. A lot to celebrate, Mr. Speaker. We still have to work because you have more sick people now than you had 10 or 15 years ago. Because of the foods that we eat and lack of exercise, and all of us have our vehicles, so we no longer walking anymore. We jump in the vehicle from our kitchen, with the garage. We park in front of our workplace. We go inside 2 steps. And because those of us who checking our steps on our phone, we see how much steps you make. Very few steps some of you make. I'm better. You've got to make 50 steps in a day, so 20. You understand what I'm saying? So we don't walk, we don't exercise as much as we should, we don't eat properly as we should, and so forth. So we have more sick people in the world, not Dominica, in the world now. And so the pressure on the public health system is huge. And in a country where you do not have private health investments in private facilities, outside of Dr. Falipe, who was a health facility, you have a pressure. And the point is, people now, because we become a bit more sophisticated, we no longer want to go to the health center. As I said yesterday, we all want to go to the hospital. So even if a headache, a basic toothache, anything, we go to the hospital emergency facility. When a stop at the health center could have done the trick for us. And so we have to reorient our attitude towards the healthcare. But I agree entirely with the view that we have to look at the issue of health financing and the sustainability of it. That not in an effort to deny people access, but to ensure that you can at least make something to cover something. And when I look at the records of the ministry of the hospital, and I'm not even going to go beyond before 2022. When I look at just 2022 to 2024, early part of 2024, you're talking about close to $8 million in fees that haven't been paid to the hospital. Now, people from Dominica and the Caribbean who go to America and to have babies, and who used to hide and not pay and give America false address. You know what the hospitals got the American government to do? That they send your name now to the immigration people, and they go after your visa. You have to pay. If you go to the hospital, already it is being highly subsidized, and they give you a little bill. For Christ's sake, pay the bill. Pay it. Because if we're able to collect half of the $8 million owed between 2022 and 2024, we can understand what the hospital could do with that. You can understand what the hospital could do with that. Because running a 24-hour facility like this is huge. You don't want to know about the light bill. Because every piece of equipment pulls a lot of current. And you cannot turn on the plug and turn it on. So I believe that we have to elevate our conversation in Dominica. We are a bit too negative, focusing on negative, because people believe that when they criticize, it's scary, they make it look bad and so on. But I'm not the one giving injection at the hospital or prescribing medication for people. It's the doctors and nurses that you criticize, not me. It's not me. If you look at the records, you will see that insofar as providing the staffing, providing the infrastructure, providing the equipment, providing the resources, this government has always delivered for healthcare in Dominica. Always. Including supporting so many families, so many individuals who seek medical care overseas when the need arises. Notwithstanding the challenge that when we owe in people, we have to set aside who we owe in and try to save a life. It's huge. But when somebody comes to you and the person has to fly and the person needs $100,000 US, what do you say? What do you say? So I find that we have to stop this penchant of being negative and criticizing, and we give people the impression. And what is happening, Honorable Speaker, is that there are some people who believe the negative stories, and then there are people who get sick and refuse to go to the hospital until it's too late. And when they get there now, it's too late to save them, and then the people die at the hospital. And so I support these bills. I think, Mr. Speaker, as I said, Honorable Speaker, that these bills will go a long way in enhancing the delivery of healthcare, and enhancing professionalism, enhancing accountability, enhancing transparency. And of course, the Minister may have mentioned the huge project that we're engaging in on health records and upgrading the system to make healthcare more efficient, having things more accessible by use of technology, including, and even sometimes when people say we don't have medication, and it's not that we don't have medication, but we still have the old school approach, where everything is on paper, rather than a doctor going on a computer system and saying the medication that's available. So all of those things are going to change at the hospital. So that doctors could know, well, if you don't have, if the doctor prefer drug A and drug A is available, but you have drug B, C, D, E that you can prescribe that will do the same thing. But Before I sit, Mr. Speaker, I want to end by saying again, if we want to reduce the pressure on healthcare in this country, we have to address the high prevalence of CNCDs. About 7 years ago, we increased in a recurrent fashion the pharmaceutical bill at the hospital, at the Ministry of Health, by $5 million in one go. And that was to, and all of that $5 million went into the procurement of higher grade, if I may use that term, medication to treat CNCDs. So the men who suffer from hypertension, there are different drugs you can prescribe. There's one which affects you if you take it. So the men were not taking it. But the other one is more expensive. It's about 4 or 5 times more expensive. So we have to buy it to encourage, just to encourage people to take the medication. There are other medication to treat diabetes and renal failure, all those things that we have to increase so that we give people the best drug that is available to treat them. But I'm making this point to say, Mr. Speaker, that if we take care of ourselves and we reduce on the incidence of CNCDs, now that is money that we could spend elsewhere. We could spend this money on tourism, marketing minister. We could use that money to build the road connecting Layu Park area so that my friends in Layu Park, that their economic opportunities can be enhanced. And I want to say to them that next year we'll fix that road. There are a number of things we could do with it. But at the end of the day, you have to make choices between people's life and a piece of infrastructure. And the monies are diverted to health. But we really have to do more as a people. And as I said last night, that when I speak about health, CNCDs preoccupies me. And I don't think that the nation, not the Ministry of Health, because it can't be the Ministry of Health, I don't think the nation is seized with it sufficiently. This, and so it's something that we have to address and address urgently, Mr. Speaker. But again, I commend the Minister for Health, the staff of the Ministry of Health, the hospitals and the health centers. I went to Portsmouth on Sunday night at the Portsmouth Hospital, and I was pleasantly pleased to see how well kept the regional hospital, what we call the Portsmouth Hospital, is kept. I think the people did a pretty good job there in keeping the place clean, and I think there has been a remarkable improvement from some time back. So I want to commend the nurses there who I met were upbeat, they were engaging, the support staff, they were all running around trying to help and trying to provide support to the patients over there and to the families over there. You can see a good spirit. And I think all we have to do as citizens is to encourage them by highlighting the positive things that they're doing, while at the same time saying to them, we have to do better in some areas. But we cannot give people the impression that they are not doing a good job. And on the issue of nurses and the recruitment of nurses, it is something that I have continued to raise with the foreign governments. The UK recently I raised it to them. The US government, the Canadian, in terms of their recruitment practices. That's affecting the entire Caribbean and indeed the world. And so we have to continue to do more for nurses. We've increased the number of positions for nurses to allow for greater upward mobility, for better pay, and those positions will be filled, and recognition will be given to those nurses who are diligent. And we have to applaud the nurses who have decided to stay home and, and really working the magic. Really working the magic. Sometimes they're doing double shift because they want to provide the care and service. So let us speak from a positive standpoint about things while we work together as a nation towards addressing these issues. Because at the end of the day, when all of us sick, as have been said before, that the first place we'll go, even if we have insurance, you will have to go to the hospital to be stabilized to airlift you to country. And what kind of hospital do we want? And if we condition the minds of people, because in psychology there's negative conditioning and positive conditioning. Negative reinforcement, positive reinforcement. If we keep pounding people head a negative, people will start thinking and behaving negative. And the people who what is that glass? I find you like to break glasses. What's your name? I think we have to put a charge for broken glasses in there. We want to give the Minister of National Security a plastic cup next time. Yeah, plastic cup next time, just for him. And you put black on it. Or paper. That way paper one better. More environmental friendly. Yeah. So, Mr. Speaker, we have to do more about this thing. And the negative conditioning of people is not good for the citizens, because those who will not go are those who have less understanding, and those that will need the most help because they may not be financially able to jump on a plane or call an ambulance, to call an insurance company to go out. And so we have to protect the unsuspecting. And health, when it comes to health, Mr. Speaker, Honorable Speaker, I never play politics with health. I say when people come to us for help, even people who don't support me, I understand that they're even skeptical to come because they believe that we won't help. But we have never turned down anybody who's come to us for help. Never. We do two things to these people who come. Everybody who comes, we give them the financial help and we offer prayer for their recuperation. And we've never asked anybody who you support, who you don't support. And we have opened the Treasury on a Sunday. We've opened the National Bank on a Sunday to airlift people out of the country. And this is the extent of our commitment. This is what we call the legacy of commitment. And this legislation forms part of the future of hope. That notwithstanding the challenges, that we will overcome and ensure that we remain a hopeful society. But when it comes to commitments and delivery, this Labour Party has a legacy of this, a legacy of commitment. And we're developing the future of hope with the two flights now from Miami, and the flight coming from North America, from New Jersey, and quite possibly one coming from New York in 2025. Fingers crossed. Knock on wood, Mr. Speaker. We're getting places, and I think the healthcare is crucially important to all of this system of creating the hope for the country. Thank you.
Thank you, Mr. Speaker. And having considered the remarkable delivery by the Honorable Prime Minister, or their leader, Mr. Speaker, he has effectively wound up this debate, this discussion. And I can only say that I am humbled and I'm happy to be part of a Ministry of Health that is tethered to this legacy of commitment and that future of hope. Dominica is in a better place today. I think this parliamentary session was good on so many fronts, particularly for us today in the Ministry of Health, Wellness, and Social Services. We certainly look forward to the inherent benefits of this quite progressive legislation. And to say also that we have absolute belief in the hospital authority, Mr. Speaker, and in our spirit of transformation that has occurred or is unfolding over the past 24 years, we look with tremendous optimism to see and to realize the benefits of what is to come in the future. Mr. Speaker, we acknowledge and appreciate the challenges that we have had in healthcare, particularly with healthcare financing. It is not something that is unique to Dominica, but we are bold, we are visionary in our approach towards financing healthcare and looking at other ways in which we can augment healthcare financing. We are looking to public-private partnerships, microinsurance, and national insurance, among others, Mr. Speaker. We believe, Mr. Speaker, that the support that the government is providing, the subvention, while it goes a long way, there are many things that we would like to do. We've spoken earlier of the fact that we have many specialized medical doctors who are here. However, there are some inherent challenges with what they can do. We have a neurosurgeon, and while in the past we've had to fly out someone who's maybe suffered the most mild stroke, for example, or cardiovascular accident. However, right now we're at a point right now where we can do the necessary imaging and diagnosis. Where if you were to be flown out now it's really for medical treatment and not merely just diagnosis. However, we're at a point right now where in our spirit of transformation, we want to get to the point where we can address more of these challenges and do more procedures and use our specialists completely to the fullest extent of their training. And that is why we believe it's the time to accept this piece of legislation to embolden and empower the hospital authority in a way that it can continue to empower them to move from one frontier to another. We would like to see in the future that there's continued development in our cardiovascular section, Mr. Speaker, where we can in fact have our cath lab, Mr. Speaker, where we can monitor the arteries in the heart and the various chambers and treat issues like narrowing of blood vessels and so on. We are hoping to get to that point. That is what we would like to do. We would like to get to the point, Mr. Speaker, where we can decrease significantly, and we have already, our bills in terms of medical transfer. We want to get to this point where we can do angioplasty right here in Dominica because we have the experts, we have the imaging equipment, but what we need now is our cath lab, Mr. Speaker, and so on. And that is the spirit of this legislation, to continue the transformation that has been taking place over the past 24 years. I'm happy more than anything, even beyond just this legislation, but the extent of this discussion that occurred here in the walls of this chamber, to educate everyone in terms of the milestones that we have achieved and the evolution, where we started and where we are today. And we can all agree that we have accomplished a lot. And it's always noteworthy to sometimes stop and reflect and highlight the tremendous accomplishments that we have made. It's time for us to be more positive, as Honorable PM has asked. It's time that we celebrate good things and the successes that we have as a people. It is time, Mr. Speaker, that we stop looking at others as being better than we are, Mr. Speaker. It's time that we reflect deep within ourselves and we identify with that greatness that we have been blessed with as African and Caribbean people and Kalinago people, Mr. Speaker. It is that time, Mr. Speaker. We have the absolute potential to be great, and we are doing well, and we have accomplished tremendous feats, and we need to continue seeing that positive spirit deep within ourselves. And for those who may have it, any inferiority that we may have, it's time to rid ourselves from that, if it exists, Mr. Speaker, and to be grateful. And to be grateful, Mr. Speaker, because a grateful people will continue to be blessed. And I ask all that we reflect deeply and be more grateful. Mr. Speaker, while we have had tremendous focus today on the hospital, I want us to also reflect on the fact that we should take personal responsibility for our own well-being. And this is something that has been championed by the Prime Minister for many years now. We spoke earlier to the issues of social determinants of healthcare, that there are some things that we are born with, some things that are inherent, some things that we have no control over. But there are many things that we have control over. So when I went to the hospital to visit someone 2 weeks ago, and I spoke to a young man in his late 20s who told me, who requested that after he's been healed from surgery, broken bones, broken hip, Mr. Speaker, that he wants employment because he's flat. What he means, he's broke. He's been unemployed since he's been in this accident. And when I think about this, Mr. Speaker, while I won't shun him in any way, but had this accident not happened, he could have been in a different place. He could have been spared from $11,000 for the orthopedic hardware that's required for surgery and so on. He could have continued to have his job and so on. So again, while no one's looking for accidents, an accident is an accident, but there are decisions that we can all make as a people. When we ride our bikes, Mr. Speaker, whether we wear our helmets, these are the decisions. And whether we have our little child, taking them to school and they're behind us or in front of us on a scooter or T-Max or whatever it may be, these are the choices that we have. These are the things that we have control over, Mr. Speaker. These are the things. And when we see on the various wards in the hospital that out of 30 beds, most of them young males with accidents requiring surgery, the orthopedic surgeons are busy at the hospital. Then we have challenges finding bed space for people who suffer other accidents, medical accidents that they have no control over. These are the choices that we have. And that is why, Mr. Speaker, everything is coming together with us having to make decisions on increasing the excise tax on sugary drinks. Because we have to help our people. While we aren't forcing our people in a corner to make decisions that we want, but we have a wider responsibility to protect our people, Mr. Speaker. And this is what this parliamentary session was about. And I appreciate the contributions of all in this chamber. Appreciate the support of everyone, Mr. Speaker, in preparing this legislation. It's not about me. It's not only about Ministry of Health, Wellness, and Social Services. It's about all of us. And I think after this parliamentary session, I'm satisfied that we are in a much better place here in Dominica. Our health system is much better structured by the passage and enactment of this legislation, and our governance structure is much improved. Thank you, Mr. Speaker.
This concludes the debate on the bill. It has been moved and seconded that the bill shortly entitled Dominica Hospitals Authority Amendment Act 2024 be read a second time. Those in favor? Those against? The ayes have it. The bill will now be read a second time.
Dominica Hospitals Authority Amendment Act 2024.
The bill will now stand committed to a committee of the whole House to be considered clause by clause. 2024 pass the committee stage without amendment. The question is that the report of the committee on the bill be adopted. Those in favor? Those against? The ayes have it.
Mr. Speaker, I move that the bill shortly entitled Dominica Hospitals Authority Amendment Act 2024 be read a third time and passed.
It has been moved and seconded that the bill shortly entitled Dominica Hospitals Authority Amendment Act 2024 be read a third time and passed. Those in favor? Those against? The ayes have it.
Dominica Hospitals Dominica Hospitals Authority Amendment Act 2024.
The bill has been read a third time and passed accordingly.
Mr. Speaker, I take the opportunity, if you leave, to extend again Merry Christmas to everyone, every member of the House, and of course the staff, the clerk of the House, and the wider public service and the entire nation. This is a time of being joyous, a time of extending peace and love and happiness, and it's a time of giving. It's a time of sharing, and I do hope that each of us, will invoke within us the spirit of sharing and the spirit of giving that can bring joy to each other. So I wish everybody a wonderful time. I think we have been very productive in the House for the last couple of days, the day and a half. I think the country has achieved a lot by this session, and we do hope that the implementation of those measures can continue to redound to the benefit of the citizens of Dominica. It's a wonderful way to end this year in the Parliament. We've, as I said, a number of progressive pieces of legislation, the resolutions that are all going to benefit the people of Dominica. So thank you, Mr. Speaker, for your oversight of the proceedings, and of course the clerk was always very efficient with providing support to every one of us, and of course to the stenographers who were there diligently. They don't utter a word, but they type in every word we say to ensure that the records of the Parliament can be held for posterity. Thank you very much. And with this words, Mr. Speaker, I move that the House be adjourned. Sine die.
Seconded.
It has been moved and seconded that the House be adjourned. Sine die. Those in favor? Those against? The ayes have it. House is adjourned. Sine die.
Mr. Speaker.